Atorvastatin is one of the most important medications of all time. It's the flagship of the statin group of medicines, which is used to prevent cholesterol buildup in arteries. When used in the right people, it can decrease the chance of heart attack and stroke by up to 45%. But obviously, it's not for everyone because there is the potential for significant side effects. It's a generic, inexpensive medication. It was called Lipitor until the patent ran out. Doses usually range from 10 milligrams per day to 80 milligrams per day. Generally, higher doses are felt to be more protective. It works by decreasing the LDL, or bad cholesterol, and possibly by other means. There are two main groups of people where atorvastatin can be useful. The first is people who've had a stroke or heart attack or other blood vessel problem. It can be used to help prevent another one from occurring. It's really quite well proven in this group of people to be helpful. The second group is people who have a moderate to high chance of having a stroke or heart attack, but they haven't had one yet. The medicine isn't as well proven in this setting, but at this time, doctors are encouraged to use atorvastatin for people who have moderate to high chance of stroke or heart attack. I'll go into more depth about who should be on atorvastatin in the Atorvastatin 2 video. The biggest concern most people have about atorvastatin is side effects. Here's a chart that gives the approximate chance of different side effects from happening. Muscle aches is the most common side effect. This could be in the shoulders, the legs, the buttocks, pretty much anywhere could start to hurt. It happens in about 1 in 5 people. Sometimes it's quite mild and the medicine doesn't have to be stopped, but frankly, in most people with muscle aches, I end up stopping the medication. Another side effect is tendonitis. It happens in about 1 in 50 people, so less common than muscle aches, and that's going to involve aching of the tendons of the ankles or wrists, elbows, again, anywhere. A third side effect, which is a dangerous one, which I've seen on a couple of occasions, is rhabdomyolysis. This is a problem with the muscle cells. The medication causes the muscle cells to be damaged, and they leak their contents out into the bloodstream. This can poison the kidneys and cause a person to end up on dialysis, and it can really be a major problem. Fortunately, it's infrequent. It happens about 1 in 25,000 people on the medication. Another common side effect is non-permanent liver inflammation. This will show up on a blood test that's abnormal. It's usually not dangerous, and we either decrease the dose or stop the medication and switch it to a different statin when this happens. Liver failure is a bad side effect that you hear a lot about with the medicine, but it's extremely uncommon. Happens in about 1 in a million people who take the medicine. Diabetes is diagnosed in 1 in 250 people on the medicine as a result of the medication, so this is listed as a side effect. I think it's helpful to look at the things that atorvastatin doesn't cause. At this point, it doesn't look like it causes dementia or cancer at all. I think it helps to think about the chance that atorvastatin is going to help someone as compared to the chance that it's going to hurt them. It has a 1 in 10 to 1 in 5 chance of preventing stroke, heart attack, or death. And it has about a 1 in 5 chance of causing muscle aches. Those are pretty similar. If the medication causes muscle aches, then we decrease the dose or switch it or stop it, and the muscle aches goes away. So a concern about muscle aches isn't really a good reason to not start the atorvastatin. The dangerous side effects of atorvastatin, possibly life-threatening, occur 1 in several thousand or many thousand people. So there's a very low chance of that happening and a much higher chance of the medicine helping. And that's why we use it so much. Unfortunately, the risk of major side effects is real, and I have seen them. But the chance that the person will benefit from the medicine is generally much greater than the chance that it will hurt them, as long as it's being used in the right people. Please see my Atorvastatin 2 video for discussion of who should be on the medication. I hope you found the video useful. If so, please click subscribe and thumbs up. That always helps to get the feedback. Thank you.